Hello, everybody, and welcome to the City Worker Public Health Briefing hosted by the New York City Department of Health and Mental Hygiene. We're going to give folks a few more minutes to join because it is 12 on the dot. Yeah, just welcome to the space. Thank you for coming. We'll get started around 12:03. Thank you. Hello, everybody. We're going to get started in just another minute, just giving folks a little bit more time to join. Welcome to the City Worker Public Health Briefing hosted by the New York City Department of Health and Mental Hygiene. We'll get started in just 1 minute. Okay, hello, everybody. We're going to go ahead and get started. Again, welcome to the New York City Department of to the City Worker Public Health Briefing hosted by the New York City Department of Health and Mental Hygiene, also working with folks in WorkWell. This presentation is the accumulation of a lot of work from city workers working in the New York City Department of Health and Mental Hygiene. It represents many hours of hard work to pull all of these images and information together. Wanted to name and acknowledge all folks who contributed to the slide deck, and also just want to share that the folks presented today, myself and Dr. Wong, we are public health experts and doctors or physicians. We can speak to the public health and some of the medical side of things, but when it comes to policy, we can't really speak to that. So we definitely defer folks to folks who can speak to the policy experts. Just wanted to say that to set expectations. So we will go ahead and hop right to the presentation. So the agenda for today, for folks who are new to the space, may look a little bit different. We took a short pause over the last few months with the multiple crises going on, but we're happy to be back. We're actually transitioning this space to be a bit more comprehensive and to talk about some of the many things, the many priorities of the agency and priorities that we think that folks in the city should be aware of. So first, we'll talk about the NPV outbreak, an outbreak that we're definitely in a much better place than we were a few months ago. So we'll speak a little bit to that experience and kind of give an overview of where we are now currently. We'll also talk about COVID-19 as we are moving into the fall, cold and flu season. I'm thinking about the many respiratory viruses that we want to protect ourselves and our community from. So we'll speak to those, and then we will also raise some other public health concerns and share some announcements coming from the New York City Department of Health and Mental Hygiene. So we'll hop right to it and we'll start talking about NPV updates. So NPV, or monkeypox as it's commonly known, where we are now in the United States, you can kind of see the image on your screen, the 5 states, the 5 US states, and also the territory of Puerto Rico is represented, color-coded based on the number of cases per state or territory or region. And you can see the deeper the blue represents higher states, higher numbers, and as you can see, a lot of our states with some of our larger urban centers have had pretty high case counts. Overall, the United States has had over 29,000 cases reported in the US, and of those, more than 29,000 cases, over 3,700 of those cases were in the city of New York. At one time, we were the epicenter for the United States and for the world for this outbreak. Thankfully, we have come to a different place, and I will talk about what's been going on the ground on the next slide. So what you see today, what you see on the screen now is a visual representation of the new cases of NPV in New York City by day. This slide is broken out on the bottom. You can see along over time, and you can see along the y-axis or the up and down, you can see case numbers. The light blue bars represent daily cases reported. And so as you can see towards the end of July, early August, you can see that's where we had our peak. You can see that across New York City, we were having over 90 cases a day at some times, dozens of folks testing positive for this highly contagious, very uncomfortable infection called NPV, called monkeypox or NPV. You can see, if you follow that solid blue line, which is the average over the 7-day average of cases, you can see where we've come, how we've been able to flatten that curve. And if you kind of follow to the far right of the screen in that light gray, you can kind of see where we are now, where the case counts, we're averaging 2 to 4 cases a day across the 5 boroughs. So we've definitely come a mighty long way, and this reflects a lot of work, from folks to get these numbers down, which we will talk about a little bit on the next slide. So really just wanted to highlight a lot of our progress and highlight the work of community engagement. The New York City Department of Health and Mental Hygiene, we were only able to get, though the city was only able to get to this point right now with the work and partnership of a lot of community-based organizations, a lot of folks doing a lot of hard work, and a lot of folks in the community members, community advocates not associated with organizations, really all coming together to organize around controlling this outbreak public and protecting our friends and neighbors and fellow New Yorkers. So just want to highlight some of the big things that we were able to accomplish in these partnerships. So we did a lot of engagement around during the Pride months, understanding that the communities most impacted were communities and social networks of folks who identify as men who have sex with men, and folks in those networks. So other folks who identify as LGBTQIA and their social networks. So what we were able to do in these various Pride events is really to be on the ground, meeting folks where they are, to have non-judgmental, non-stigmatizing conversations about a very stigmatized topic. Things that are following patterns of sexual transmission, and things that are disproportionately affecting folks in sexual or gender minority communities. So we're able to pass out over 14,000 different materials during our outreach. We were not just at Pride events. We were at circuit parties, where other venues where folks would meet and engage with folks, to meet folks where they are. In those Pride outreaches, we were able to contact directly over 40,000 people. We also did a lot of outreach amongst the priority populations and across various neighborhoods across the 5 boroughs. We had multiple events, where over 550 events actually. It was happened just over the summer. I think that's pretty impressive. We've engaged over 46,000 folks in these events, and this is cumulative. This is apart from these for Pride specific events. We were able to schedule nearly 1,000 appointments for folks, and these are folks. This was all direct. All of these appointments were from these direct engagements. This is not to mention folks who were given the information for walk-ins, given materials on how to set up their own appointments, which is also part of it too. So just wanted to highlight that. To the right of the screen, I just wanted to name and shout out. We got the folks, the MPV community engagement work was shouted out, or was named specifically in the New York Times recently. The paper of record. I'm just really naming the work that has been done, and really kind of summarizing that work. Recommend folks to check it out. You can see some of our colleagues in there, some of our hardworking community advocates voices are highlighted. Just really again documenting that the outbreak of MPV is a story of community engagement, and that's how we got through this, and that cannot be said enough, that we all got through this together. The MPV, some of the news as we see, from that prior slide, as cases are winding down, a lot of the public health conversation is how we can integrate this into a more holistic view. One attempt to break down barriers and to increase access for this, for vaccination and treatment, the New York State Health Department declared an emergency authorization to temporarily designate MPV as an STI. That's not to say that this thing is permanently an STI. That's not to say that sexual transmission is the only way that MPV spreads, but I think it's an important acknowledgement that we've seen it spread through follow certain patterns, and understanding that because of this mode of transmission that we're seeing, we know that some of the social factors do impact availability of testing and access because of the stigma and the marginalization that can be associated. So this is a temporary change to increase access for it's basically for public health law, and the increased access for some folks, for people 18 and younger, who may not be able to get parental consent for something that is associated with sexual transmission, or is following those patterns. What we do not know at this time is how this thing will be classified in the future, understanding that it's not solely transmitted through sexual contact. But I think for now, this is where the classification is. And I think the bigger takeaway is to increase access and to lower barriers to care. So As we are transitioning away from the acute or emergency phase of the MPV response, we're actually transitioning our existing vaccine infrastructure. As folks may know, there were these large pop-up and mass vaccination sites at large, at some large sites across the 5 boroughs. And earlier this week, we actually transitioned some of those spaces down. So the Times Square location, which was very popular, also our location in Long Island City, our clinic in Livonia, and Tremont, and Central Harlem, those mass vax operations have wound down. But it's important to know that the landscape is still there are still vaccines available, not just in our clinics that are run by the city. For folks who want to kind of see the whole range of availability, we recommend folks to go to the Vax Finder, the link at the bottom. But did want to name that the vaccines are being integrated into the sexual health services that we offer at our DOHMH sexual health clinics. So folks can get vaccinated in the Port Green Clinic in Brooklyn, in the Jamaica Clinic in Queens, in Chelsea, in Lower Manhattan, and then Morrisania in the Bronx. And there's also the vaccine is also available at health and hospital sites on the screen at the five Pride clinics, and then also at their 11 acute ambulatory clinics. So folks still have the opportunity to get vaccinated against MPV. Folks still have the opportunity to get their second dose. So to get fully vaccinated, it's a 2-dose regimen. Folks can get that second dose at any of these sites as well. And just really encouraging folks, if they haven't been vaccinated, to have conversations around sexual health and with their providers, if this is something that they would benefit from, because the eligibility has changed, and the way that we're looking or prescribing or recommending the vaccine has changed a bit, to pre-exposure prophylaxis. So not just an emergency phase, but what are the risk and what would be the recommendation for MPV vaccination based on risk, either for personal risk or risk that may be or risk coming from the sexual partners that we engage with or folks who we are in community or network with. Okay, transitioning from MPV, we'll go to Old Faithful, COVID-19. There's been a lot of updates in the world of COVID-19. And I think as we are transitioning into the deeper cold and flu season, as temperatures are going to be consistently lower, we definitely want to, reinvigorate this conversation around COVID-19 and how we can best keep ourselves and our community safe across New York City. So I wanted to put this slide to kind of show some historical trends, because I think it's an important context for the conversation. So what you can see right now on the screen is a visual representation of case trends in New York City since the very beginning of the COVID-19 pandemic. I'm not going to regale you with all of the history of the pandemic and what we've been through in the last 4 years, but what I want to show is kind of show some of the patterns and trends to kind of do some level setting. So if you follow to the very far left, at the very bottom, I think where you can see my mouse, you can see where we were. This was the initial wave when we did not have a lot of testing. You can see that that first fall winter wave that we had in late 2020, in the 2020 to 2021 cold and flu season. You can see that's where we had our second wave. You can also see I'm going to mute you. Okay, and then you can also see to the far right, you can see fall winter of last year, and you can see the Omicron wave, and Omicron came and hit. So case counts were pretty intense, but the pattern is fall winter cases tend to climb. We've seen over the last few months, over the summer rather, in other parts of the world, where in the Southern Hemisphere, for example, in Australia, as an example, our summer is when their winter happens, and Australia had a very intense COVID and flu season, and we're already seeing that start to take place in New York City. So if you so at the bottom, following my my mouse, you can kind of see where we are now, where we've kind of plateaued, or you can kind of see where we're kind of flat, but flat on a kind of high, and we'll unpack that a little bit on the next slide. So this is just basically zooming in on the last few months of that last image. And so you can see where we have been, we're basically consistently having around 200 folks testing positive per every 100,000 folks tested. That's kind of where we are. And as you can kind of see, it's been pretty flat. We're having the percent positivity, and these are of the PCR test. So these are the folks getting that PCR nose swab by a medical professional. This is just like a snapshot of what that looks like. This does not take into account home testing, but just looking at what these kind of overall rates are, we've seen that the testing it's been around 10%, hovering around between 9 to 11% of folks who are testing for COVID-19 are testing positive. So we've kind of flatlined at a rate where it is a bit kind of high. So that said, knowing how the patterns are, checking the news and then seeing what's going on around the city, we really just want to think about COVID-19, how we can what are the tools that we have that public health offers, that medicine can offer, and the skills that we've all learned over the last 2 years to keep ourselves and our community safe in preparation for something, for this thing. I guess one of the ways that we talk about it, you get yourself and your community ready for the winter. You get your new winter coat, you get your new gloves, you get your hat, and we really want to talk about other things that we can do to prepare. Masking is a part of it, but so is testing. So when we talk about testing, there's a lot of different considerations for testing, but testing is a really important tool that we can use. Knowledge is power. Knowing your COVID-19 status is important. Yes, it is a bummer to test positive. You don't want COVID-19 to get in the way of your plans. You don't want it to ruin your holidays. You don't want it to, get in the way of your dates or whatever, but it's definitely something we want to be aware of so that we can help prevent those chains and not spread it to folks. So when we think about testing as a tool, even unfortunately, because of the way that this virus has mutated, being fully vaccinated doesn't mean what it used to mean back in the day, where yes, it can fully prevent infections, but it's still really helpful. So when we're thinking about testing, testing is a way, testing recommendations. Just want to kind of give some straight up recommendations for testing. So number one, if you have symptoms of a cold or flu, you're feeling fatigue, you have a runny nose, a sore throat, change in taste or smell, the important thing to do is to get tested for COVID-19, but also to consider some of the other viral, viruses that are circulating around that have similar symptoms. We'll talk about those later, but, cold, the common cold, the non-COVID common cold, flu, something called RSV. So you want to get tested and figure out what is causing these symptoms, the runny nose, all of this. You want to rule out COVID, but you also want to, talk to a provider for testing for other things. Number two, if you were exposed to COVID-19, but you don't have symptoms, if you want to be sure, the recommendation is to get tested 5 days after that exposure. You can get tested as early as 3. Some folks get tested on day 3 and also day 5 for reassurance, but you want to get tested at least 5 days after a known exposure. I think that if you, for that due diligence, you can, that's the recommendation. Some folks get tested every day from after an exposure, but really, if you kind of really want to do it, 5 is a good number to consider getting tested and know if in fact you were infected from an exposure. Number 3, consider testing before contact with someone at a high risk for severe COVID. And the last bit, especially if you're in a time where there's medium to high transmission. So that bit can feel a bit complicated, but what we're thinking about now, in seasons like right now, where we see that the transmissions are there and there is this uptick fall, winter, when we're thinking about visiting folks in our communities and our families, people who we take care of, getting tested before we see those folks is important as an added layer of, I don't want to expose, grandma, older family member, friend, or a client to this thing. So let me just get tested before I see them. That's an intervention, a kind of community-based intervention or recommendation to really be mindful of certain folks who may who may be at who may have greater consequences if they become infected. So just wanted to share that kind of overview on what we can do for testing and thinking about how we can prepare ourselves, getting some of the home test kits available, having a decent supply at home is something that we can do. And then really just knowing when we would consider getting tested. Not to say you get tested every day or every week, but there are some instances where where testing may be an important thing to consider in winter safety. Okay, so that said, treatment options are available. This is kind of newer for a lot of folks. A lot of folks have gotten these treatments, but we want to make sure that we really highlight that treatments are available. This is something, within the last year has become a lot more accessible and more widely available. So though not a substitute, these things are a great addition to our COVID safety toolkit. So the treatment, they lower the amount of virus in your body, they reduce symptoms, and can also help prevent hospitalization. They work better the sooner you get started. There's an oral pill that if you start within the first 5 days, based on symptoms and based on your risk, you can actually help cut the severity of illness and help shorten the length of infection. Also, there's what we call a monoclonal antibody. So it's not just a pill. There's a treatment, an infusion, a one-time infusion with antibodies to help fight an infection. So that said, there's multiple treatments available. So knowing your status, getting tested, and knowing your status sooner than later is important because it opens up your access to multiple treatments, effective treatments. You can access them sooner and start the process of recovery sooner. That said, we'll transition into talking a little bit about vaccines. Hey, Dr. Wong, we're talking about vaccines. So the data that I want to show this is historical data, but I think it's something worth mentioning. So looking to the left, this is kind of where we have been for adults across New York City for the primary series. So this is folks who getting vaccinated. This was what 2021 was all about, talking to folks, getting folks vaccinated, making sure that we can reduce barriers, making sure that we can address folks' concerns. There are also other things that happen for folks getting vaccinated. But looking at to the left, you can see that basically around 98% of adults or people 18 and older had gotten at least one dose of the vaccine, and around 90% of folks, 90% of folks of adults in New York City have completed that primary series. So those folks have been vaccinated, up into 2021. And so what we're encouraging folks now is for 2022, just like the flu, what we're recommending is to get a boost for this winter, for this fall, to get that dose to be up to date. The virus has changed and mutated a lot since last fall, winter. These Omicron subvariants are nothing to play with. These things are highly transmissible, and these viruses have ways to bypass a lot of our immunity. But what we do know is that these vaccines over the last few months, we've shown that the vaccines have been safe and effective at reducing hospitalization, reducing severity of illness, and preventing death, which is important. I think a lot of times we focus on just one outcome, which is prevention of infections. That's one that is important, and that I wish that the vaccines retained, but because of the way that the viruses have mutated, we've lost some of that. But these other things are really important too. Hospitalization. We know that hospitalization is a huge burden on folks, and in public health, we don't talk a lot about money, but I think it is, the financial burden of missed work, of keeping a kid out of school, that is a huge burden on folks, especially in these financial times. Also, the psychological burden of being ill, being hospitalized is something really that can impact folks, really negatively impact folks. So we do want to just name that these vaccines are really helpful at that, preventing hospitalization, preventing severe illness and death. So that's why we're encouraging folks who have gotten the vaccines previously to really consider getting an updated booster to kind of keep, to keep that level of protection high. And so if you do, unfortunately, if you do get this thing, so it doesn't have to be something that truly interrupts your life, or that you end up in the hospital for, or that this is something that ends up causing some severe complications. Okay, that's kind of adults and adults. For children, to the right of the screen, you can kind of see where we are breaking down vaccinations for in children by age groups. What we can see is that for children 13 to 17, the rates of vaccination of completing the primary series has also been really high. So we want those kids 13 to 17 to get their boost as well this summer, to keep that level high, so that going into this winter, affirm that original choice, get that vaccine high, get that immunity level high, so we can make it through the next few months, so that we can prevent hospitalization of those kids. Kids 5 to 12, the rates of vaccination have been a bit lower. We can do better, but we really want to encourage folks to vaccinate kids 5 to 12 too, because we don't want those school age children, in elementary school. Those are the time we've seen a lot of the impact of being out of class, missing days of school, what that impact has been. So we want to encourage folks to consider vaccinations, as well as the other things that we're talking about to prevent a COVID-19 infection or severe complications. And then finally, that's the smaller group, the youngest New Yorkers, people 6 months to 4 years old. Folks, vaccinations around in that age group have been very low. And I just wanted to highlight how low they are, and we're talking about little kids getting vaccinated, our youngest New Yorkers. Is that the reason why it's a big concern for us is because what we've seen is, over the course of this pandemic, is that the children who are the most at risk for severe infections, this is kids getting sick, having to go to the hospital, being in the hospital for days, has been children in that age group. Are the youngest children, age 0 to 4, those are the ones who have been hospitalized at the highest rates, and who have had higher numbers of complications. And if you think about it just physiologically, or how the body works, these small little kids may not have the capacity to kind of respond to a severe infection, if not and not as well if they're not vaccinated. So just really wanted to highlight some of that, and look at the data and kind of share where we're coming from the public health or primary care angle. So bivalent boosters, just wanted to take some time to talk about the new boosters that are out. Bivalent, basically, this bivalent just means there's two different targets. Bi meaning, two, valence just like numbers, like there's two targets basically. So both Pfizer and Moderna vaccines have been authorized for these bivalent boosters. They focus on the Omicron subvariants B4 and B5, which B5 is still the dominant variant. We know that there are some subvariants that are increasing across New York City. We know that being boosted is still offering that, protecting against those more severe outcomes, hospitalization, severe illness, and death. So we're definitely recommending those vaccines for this fall winter. With the caveat that we don't have, again, these were recently developed, so we don't have a lot of long-term data on how long it lasts, or right now the level of protection compared to folks who haven't gotten boosted, or folks who are unvaxxed. But based on what we know from the immunology and the history that we've seen with these boosters, we've seen that being up to date is a major factor in determining how severe cases are and the outcomes. So these vaccines have been authorized for children 5 years and older, and as you can see, folks 5 years and older, 6 and older can get either Pfizer or Moderna booster, and children younger than 5 can only get Pfizer. So, this is just a general recommendation for getting vaxxed. Folks 6 months and older should get vaxxed. There's many different ways to access the vaccine. At Vaccine Finder, a lot of folks are able to get the vaccine at pharmacies. Folks are able to get the vaccine at some of their primary care clinics. So just calling to figure out your vaccine plan is important. In-home vaccines for our elders, or folks who are unable to leave their home. In-home vaccine is available. We're encouraging folks to sign up for in-home vax if they have limited mobility. And again, these vaccines are safe and effective and life-saving. They've brought us through prior waves and really helped prevent severe strain on our healthcare system. And they've also really helped prevent, even when we've seen variants that have been able to bypass our first lines of defense of immunity. These vaccines have still held up in preventing those severe hospitalizations. Strongly recommended. We're recommending them, and they remain free. And then before we pause, and I guess we can take a quick look in the chat and make sure if folks on the team look in the chat if there's anything that we want to address right now in time. But I just want to really highlight and center us on the things that we do know, the resources and the assets that we do know, the tools and skills that we have. So when we're thinking about preventing COVID-19, but also flu, which we'll be talking about next, and RSV, this other virus, there are some just evergreen things that, rain, sleet, or snow. These are things that we have available that we can rely on, regardless of a mandate or not. These are things that we should be considering. Staying at home if you test positive for COVID-19 or any of these respiratory viruses is crucial. If you can stay at home, if you can work from home and take sick leave or limit your exposures, definitely encouraging folks to do that. That's how we can break these chains of transmission, and that's how folks can take some time to heal and recover. Wearing a face mask. So these face masks, we've seen how they were really helpful in the early days when we had no treatment or cure, we had no vaccines. These things are just useful and really important for this time of the year. I think about my mask just like I think about my jacket now. I put on my puffer jacket when it gets cold. I just put on my mask because I know that that's when a lot of these viruses that are spread through respiratory droplets and coughing, that's when these things are out. So just normalizing that this is a tool that we can use, just like your gloves, just like your jacket or hat. Wearing a good fitting mask, especially in places with poor air circulation or in large crowds or groups. That's something that we should consider. Testing for these viruses, the more is really important, so that you can what your next steps are to help prevent chains of transmission or seek care. Staying up to date on our vaccines. All of the vaccines that we have, vaccines are vital and crucial to overall health, general health, public health, keeping us safe and keeping us out of hospitals. Keeping our hands clean. Don't gotta tell folks here, we wash our hands, but whatever we can do to keep our hands clean, especially high touch places. If we're out in public, touching a doorknob, holding onto poles in the subway, just taking the time to to wash our hands, clean our hands. Walking around with a little hand sanitizer doesn't hurt anybody. I think it's actually really helpful just to continually wash our hands, especially during cold and flu season. And then finally, getting treatment. There's a lot of treatments out there for COVID-19. And if you talk about flu, there's treatments for flu as well. And just we want folks to access treatments earlier in the course of the infection, so that folks don't have severe symptoms, or you can kind of prevent some of this progression to severe symptoms. Okay, we'll talk through flu pretty quick, but was there anything in the chat, Dr. Wong or Carolyn, that you think that we should be okay, looks like you're already
Maybe
answering.
it's okay, keep going.
Okay, we'll keep going. Okay.
I'll try to leave a little time for questions.
Yeah, let's go for it. So we're transitioning to flu. We talk about flu. We really want to talk about flu right now. It's not just COVID circulating. In this visual, the rainbow colors are pretty, but I think the message, that the takeaway from this is something very important. If you look at these reports of our flu lab tests. So these are the things that are reported to the city, to the health department, so we can kind of see what's going on, what these trends are. You can look at at the green. You can see that dark blue. You can see 2018, 2019. You can see this really high peak of infections in 2019, 2020. In the yellow, you can kind of see how things went. But looking where we are now in fall winter 2022 into 2023, this red line, this is reflecting where we are now. This is a peak that's happening really early compared to some of these other prior or historical outbreaks. There's a lot of things that are informing this. Unmasking has happened, so there's a lot more exposures. A lot of folks have been have really seen have been a lot more actively engaged in the community. And you're looking at 2020 and 2021, that it's almost a flat line. Flu was almost all the way gone, last fall winter when folks were really wearing their masks and really taking some of those measures. So you can see the impact of some of these social or kind of non-medication interventions, what they can have and what it can do. But we're right where we are right now is, we're seeing a very high number of folks testing positive for flu right now. And this is really early in the outbreak. So we really want to keep an eye on that, raising awareness on where we are with the flu outbreak, because we do have things that we do have some things that some options that we can things that we can really rely on to help break some of these chains and hopefully get this number or flatten this curve. Wanted to provide a little context of what that all translates. So from last October into this summer, in terms of flu, we've had a lot of flu. Flu is just something that's been around for centuries. But even right now, with treatments available, with vaccines available, we still see flu has a major impact on our community. So these data are from the CDC, and the CDC estimates nearly 13 million flu illnesses in the US between that October 2021 through the summer of 2022, millions of flu medical visits. But looking at the bottom, looking at hospitalizations and the number of deaths, flu is a major is a important cause of death, and something that a lot of physicians and communities are very concerned about, and something that we talk about on a seasonal kind of basis. But really want to just raise awareness that flu is something to be concerned about. And it's part of the conversation. Great thing is the flu vaccines are available. We know that it happens same time of year every year, and so it's messaging about getting flu and getting COVID-19, getting prepared against all of the things. There are flu vaccine pop-ups across the city. Folks know many different ways to get vaccinated with their providers, at local pharmacies or other places in the community. But we're really just encouraging folks to get vaccinated against influenza. It's really helpful to at least prevent severe illnesses. Folks can go at Vaccine Finder and actually find sites for flu vaccination. Wanted to just share some of the estimates of how the vaccine has impacted or helped, or how it has changed things. So it was estimated by the CDC that flu vaccination has prevented up to 7.5 million illnesses, that's basically more than a combined population of Kentucky and Kansas. So a lot of hospitalizations have been illnesses have been prevented. Same thing for hospitalizations. These are all kind of based on modeling studies and based on the effectiveness. And it's estimated that at least 6,300 deaths have been prevented due to flu vaccines. Flu vaccines, just like other vaccines, are these known interventions that have really impacted and lengthened overall human life expectancy and reduced a lot of suffering around the world. Vaccines as an intervention, as a healthcare provider and mental health and a public health provider, vaccines are for us as essential as interventions, just like antibiotics and other kind of medications. This is a really important tool that we have that can really help impact and keep folks safe. So we'll talk about some other public health announcements that we want to highlight, and then we can open up for questions. I guess we can say up to the 1 p.m. hour with some questions. So RSV, we're talking about the cold and winter respiratory illnesses. RSV is another one. RSV stands for a pretty complicated technical name, but RSV is a virus that functions similar to it's like a cold, is a cause of a common cold, and the symptoms are very similar: cough, congestion. Some folks can have fever. Most cases of RSV are mild, but it's kind of hard to know if you have it until you talk to a provider and can get tested for it. But when we're thinking about RSV, the folks who we're most concerned about are young children and older adults. If folks have been checking the news, there's a lot of conversation about RSV. A lot of pediatric facilities across the country are already feeling the strain from hospitalization because of RSV, and I think that's just another thing. Folks, one of the unfortunate down effects of of all of the masking is that a lot of people, there's a lot of New Yorkers who are out there who haven't been exposed to this at all. A lot of young kids have not been in contact with RSV and don't have an inborn, don't have an immunity against it. So now with with the changing of our activities and less mask use, a lot of kids are being exposed for the first time. So that's kind of why we're seeing this kind of this kind of outbreak going on. And so we just really just want to raise awareness about it and do what we can to prevent it. RSV, there is currently not a vaccine available for RSV. So this just wanted to share some of the things that we can do to prevent RSV transmission. And looking, this is from the CDC, but this is very similar to the things that we do to protect and to prevent COVID-19 infections. So we already know the skills, we already have the tools to fight COVID, and thankfully they translate pretty well against RSV and these other respiratory illnesses. Okay, we will transition to talk about abortion access. This is through this part of the conversation, just want to highlight some of the other public health work that we're doing in the agency. We recently are starting this first of its kind abortion access hub to confidentially connect providers, patients rather, or callers to licensed abortion providers in the 5 boroughs. If financial assistance is needed in order to obtain an abortion, there are navigators who are around who can help get folks connected and can help find financial support, facility, lodging, and everything else. I think this is really important. Really important program that's been started, and folks can also get rolled into Medicaid if they are eligible. So just wanted to highlight that. And for folks who want more information, the hours of operation for the Access Hub, Monday through Saturday, 8 to 8 p.m. The phone number is on the screen, folks. We can pause for folks who want to screenshot that. Staff will include folks who are bilingual and folks who speak 9 of the most spoken languages in the city, but also folks who use American Sign Language can also access services. Staff has been trained, on customer service, on confidentiality, and the sensitive nature of some of these discussions, especially around like reproductive justice and gender inclusive services. So just really proud that this is something that we can, given this current political climate, something that we can move forward to increase access to, a necessary public health intervention. And then finally, as we get ready to wrap up, just want to highlight the sexual health clinics, which are back in business. So the clinics, they were mobilized to respond to the COVID-19 pandemic and then also responding to the NPV outbreak. But we're relaunching and re-expanding some of the clinical services, including rapid HIV testing and rapid STI testing. And by the end of November, the goal is to offer ongoing or continuity of HIV prep services. So the city of New York, we start folks on pre-exposure prophylaxis for HIV and connect folks to care. But this pilot model in Corona will actually have folks be able to come in for continuity of care and services. Again, this is to lower barriers and to increase access to really important and necessary services. And then finally, the notes that we want to leave folks with is that basically we'll get through this together. We're the city of New York, and we got to look out for other New Yorkers, thinking about how we can change the conversation, how we can really promote and hold each other accountable for getting preventable services, getting CDC screening, getting our STI screening, getting our cancer screening, going in and getting our blood work, getting our routine care. That's all part of good public health. That's part of being, taking care of yourself, especially in the fall, winter. You want to winterize your body, you want to get ready for the cold, the dark months, and all these viruses that are out there. Knowledge is power. Sharing good information with folks, reliable information, trusting reliable sources, sharing things that make sense, sharing things that are focused on, on health promotion, and keeping folks safe. That's what we want to do. You can check in at our website or check with the CDC, just kind of get some of the best and most up-to-date information. And also just want to share, again, cold in winter, it's real. Seasonal affective disorder. Folks do get the winter blues, and just really being aware of that, having the conversation, checking in with folks, and sharing the resources that we do have. So NYC Well is available. Folks can call or text and chat. Just really checking in on each other, especially in these cold months when the nights get longer and it gets colder. And we know it's really tough on folks. Just want to name that. And thank you so much for listening. We can go ahead. I'll stop sharing the screen. We can open up for some questions. I will pause and drink a little water. And here comes Dr. Wong. Thank you.
Yeah, let me just get through. I'm going to go ahead and get to the pre-questions first. I think we can get through all of them. A number of them have been answered in the chat. Y'all can hear me okay? Sorry, I also have a little cold. Lots of things going around. Okay, so just the first question, what information do we have about the real world efficacy of bivalent boosters? That's a great question. We actually right now don't have real world efficacy. A lot of the sort of approvals on the boosters really focused on sort of antibody response in people that got it. And so, but you're right, we don't have real world efficacy in the same way that we have it for for the previous, these large clinical trials that we did when the vaccines first came out for COVID. And this is very common. We do this for the flu as well. You really won't know efficacy until sort of after the season, but that does inform sort of, the future. I think when we are making, we kind of expect that there will be a yearly COVID vaccine similar to the flu. And so any efficacy data we get will inform any future COVID vaccines. There's a lot of questions about sort of when to get the bivalent booster. You can get it, especially in relation to having had COVID. So there's two pieces of this, and it is really confusing. I've gotten lots of questions about this. So if you've had a previous booster, you need to wait 2 months to get the new bivalent booster. So that's the first thing. If you've had COVID, there's no reason to wait more than, it's not dangerous. You can get your bivalent booster as soon as you finish your isolation period. So whether that's 5 days or 10 days, once you finish isolation, you can go ahead and get your booster. The CDC also has some language that basically says, if you want to wait to get your bivalent booster because you just had COVID, it's also reasonable to wait up to 90 days because your chance of getting COVID again after having had COVID recently is actually very rare. So I think that's sort of up to you. But if you don't want to wait, as soon as you're done with your isolation period, then you can go ahead and get it. Okay, I think that was a lot of I think that was basically all the COVID questions. There's some questions about determining risk. It's really hard, I will admit, in terms of determining risk, in terms of a hard cutoff. It depends on the way things are reported. Remember also, we don't really know the true number. Right now, we're in the phase of COVID where we're just following trends. I will say that the trend is, sort of going up slowly. We still anticipate that there will be a lot more COVID cases sort of as we get into the deeper winter months. But to say the cutoff should be 10 per 100,000 versus 30 per 100,000, so many people are doing home test kits that we do not have an accurate way of actually predicting how many people per 100,000 have COVID. So I think it's not really a great way of measuring risk. And everybody also has their own sense of risk. I think what I usually do is, if I know COVID cases are generally high, and also, I'm going to be in some sort of crowded indoor setting, I just go ahead and put on a mask. Again, you can follow general trends. I'm more likely to put on a mask if I really see that COVID cases are going up. If they're low, I might be less likely. That's how I've been doing it. In terms of the actual cutoffs, it's really hard to know what the true number is because, again, we're not really getting a lot of home test reporting. Okay, anything to add for that, for the COVID questions?
The only thing adding again, just really stressing that the vaccines do a lot of things. And I think a lot of times what we see, a lot of folks it used to be that way. Unfortunately, it's not that way, that the vaccines can prevent an infection. They offer a bit of that prevention, but that's unfortunately we lost a lot of that because of this virus. It's not to say that the vaccines are failing, it's just the virus has its ways of mutating. But what they do is that they still do really well is preventing the severe infections, the hospitalization, and the death. That's one of the most important things one of the most important outcomes. And to make it be less bad, to make it be less life-threatening, that's huge. And to prevent hospitalization, especially when a lot of folks don't have insurance, a lot of folks don't have the opportunity to work from home, etc. This is a really important thing. So just really stressing that even though they don't do what they used to do, they still do a lot of really important things. And that's why we still, stress the importance of this, of getting back, of being up to date on the vaccines at this time.
Yeah,
And
so
I
there
hope
was
that you could
a,
hear.
yeah, there was a comment about the COVID vaccine not preventing folks from getting COVID, doesn't stop folks from spreading. It doesn't prevent you from going to the hospital. So why is the city pushing this vaccine? Which more studies are showing it may be unsafe? The vaccine really was well studied. So I'm not going to go through all the data for that, but it really worked. And was shown to be very safe. I think Dr. Watkins mentioned, millions and millions and millions of vaccine doses given. The other thing I would mention, I think the most compelling information is that the fact that we're not on lockdown right now. If you remember, I think people forget that we lived through that very first wave when we barely knew what COVID was. The fact that I'm not seeing refrigerator trucks outside full of dead bodies outside of hospitals, that I'm not hearing ambulances like all throughout the day and all night, really is a testament to the power of vaccines and just the work that New York City's done to really get people vaccinated. Because I think you forget how awful it was when this first came. And so I think part of that, a lot of that is because so many people are vaccinated that it's really, even though people who are vaccinated still can get COVID, but we're not overwhelming the hospital systems. We're not seeing the refrigerator trucks. We're not on lockdown. And so those really are, I think that's a compelling argument that vaccines do work, because otherwise we would still be in lockdown right now. Or, people would be dying of COVID. So yeah, this is this virus was like really a strong, powerful virus, before vaccines existed.
And treatments, we've come a very long way, I think, is a general takeaway. And it's unfortunate that a lot of these are kind of other outside forces, politicization and other things have kind of made the conversation, an us versus them, a vax versus not vax at this. But at the end of the day, from public health, from medicine, the message that we want to share is we are here for the health of the city of New York, and we are against viruses and bacteria, and anything that we can do to offer good information, real recommendations for folks to make the best health decisions for them and their family, and give the best information. That's what we want to do. And honestly, it's been really, the vaccine has really been a game changer. This virus changed a lot of things, but it's definitely helped us get through some dark times. And yeah. So were there any other questions that we wanted to go through, Dr. Wong?
I can quickly just hit the policy questions, just mainly because we can't answer them. Someone was asking, if you had sort of adverse events that are longstanding due to the vaccine. That's really a legal question that we're not really able to answer. And I don't really know of like specific mechanisms, for that. In terms of long COVID, there are clinics that also are taking care of long COVID patients. I think that's worth mentioning. I think you can find that information on our website. And then in terms of mandatory testing for unvaccinated workers who have an exemption, I'm sorry, I don't know this off the top of my head. I believe the vaccination requirements for the primary series, meaning either 2 Pfizer or Moderna's or 1 Johnson & Johnson vaccine, I believe that still is in place, although I know there's been a lot of movement in terms of like stopping some of these policies. So I think you'll just have to continue to follow the policies that might affect you. But in terms of testing, that's really dependent on, how often people are tested and that's really dependent on your individual HR policies and practices. So I can't really answer that. You need to check in with your own HR about that. And again, this only this is only, I don't think there's any mandates in regards to like getting the bivalent vaccine or any boosters. I think it's really related to the primary series. Okay, can the first booster be bivalent? Yes, absolutely. There is no longer any booster. You cannot get an old booster. So, the recommendation is people get their primary series, meaning again, the 2 Pfizer's or 2 Moderna's or 1 Johnson & Johnson, and then getting the bivalent booster. And so everyone's starting from 0. So regardless if you've had a booster, if you haven't had a booster before, you get your bivalent booster. If you've had 3 boosters before, still get your bivalent booster. Everyone's sort of starting from the same at this point. And basically you cannot get an old booster. It's like no longer available.
I see, I guess we get ready to wrap. There's a comment, I guess, more of a comment in the chat, just around the different stages of COVID and testing. So we have multiple ways to test. The at-home test kit is not the gold standard, which we kind of call as like the thing, as the gold standard. The gold standard is a PCR test where a provider has to it's a DNA test. But that home test is really important for testing, having multiples, testing, day 5, if you want to test early, day 3 after an exposure. But if you have a high suspicion of an infection, and you have concerns, even if if a home test is negative and you have the concerns, I think it should trigger a conversation with a provider to get a PCR, but also to think about the other respiratory things that are going on so that you can know what the next steps are. In that question, I think I did want to just highlight the stages of COVID, because we haven't talked about long COVID, and there is the acute infection where you have the fever, the chills, your taste and smell is gone, you're contagious. But then there is that after that, that's when there's different things that can happen. And we do see an increasing number of folks who are having these long-term or lingering symptoms. Long COVID is something that we haven't spoken about. We're still in a phase where there's still a lot that's not known about things. But what we do know is that it does happen. And so it's something that we want to be concerned about. This is something that is being studied, but I think is also kind of part of the conversation. Treatment, we think that treatment may have an effect. Receiving treatment, after a severe infection with COVID, that may have an effect. We're also seeing a couple like small kind of reports about the impact of folks who being vaccinated against long COVID, developing long COVID later. We're learning more and more about that. But anything that we can do to prevent an acute infection, and also to whatever we can do to lower the chances of long or lingering symptoms, is really important, and that's part of the conversation. And I think it kind of leans back to the masking thing. Whatever we can do to prevent risk, to reduce the risk, whatever we can do to be mindful and aware that there are a lot of transmission going on, that's part of the convo. And so as we get to 1 p.m., what we really just want to say is thank you for joining us. Thank you for always showing up. Thank you for coming to the space. Tell a friend or a colleague about the space. We want to be able to answer questions, bring folks the information. And the main takeaway is truly to take this, take this with a community response. This is not an individualist thing. We're not going to get out of this as singular people. We only get through this together. We only get through this in community, talking to folks, breaking down the barriers, having the conversation, making sure that folks who are the most vulnerable get taken care of. We have a lot of tools out there. If someone is wearing the mask, don't shame them. Let them wear their mask. If you want to wear yours, wear yours. Do what you got to do. Keep your, got to keep a lookout. So, take care of yourselves, take care of somebody else, enjoy the weekend. It's cold out there. Get ready, Thanksgiving is coming. You can do it safe. If you're going to be around someone older or someone who has some medical issues, consider having that conversation, like, hey, y'all, should we get tested before we see grandma or so and so? That's something that may save them or prevent them from, dealing with some complications. So just whatever we can do to have the conversations and be open about it. That's how we get through the difficult cold and flu season that's ahead. Thank you, Dr. Wong, as always. Thank you to Carolyn and the rest of the team who helped set up the space. And yeah, we will see you again. We will definitely have another one in December. So I hope to see folks then. Make sure to share it out there. And that's it for me. Did you have anything else, Dr. Wong?
No, stay safe.
Stay
Hang in
safe
there.
now. Yeah.